Let's talk about how to care for ourselves through the long term. Dr. Abby, I'm going to direct this to you. You mentioned perimenopause previously, and it's something that can sneak up on us. You said it can happen as early as in your mid 30s. Another example of this is insulin resistance that can sneak up on us. What should moms in their 30s and 40s be doing now, and kind of touch on, those of us that are already past the, 40-ish timeframe?
Yeah.
What can they be doing now to protect their long-term health?
Yeah. So perimenopause and insulin resistance do go together. So perimenopause, like I mentioned, it can start very early. And there's fortunately kind of a revolution happening, if you haven't been on Instagram recently, around in traditional healthcare on the importance of potentially considering hormone replacement therapy. So there are more and more providers in the area that will talk through the options with you, take your concerns seriously. There are over 40 symptoms that have been identified as linked to perimenopause. So it just, and kind of the classic is kind of just not feeling like yourself. And so I would really encourage folks, if they're feeling that they haven't gotten the answers from their primary care provider, their OB/GYN, that they keep looking for answers. And there are lots of ways to access menopause providers. There's three of us on the call. And then also there's the menopause.org website where you can find a provider. There are some pretty respected online resources as well. And so I would say just keep looking for somebody to kind of answer your questions. At the same time, because there's so many symptoms, it could be something else. And so you also want to make sure that someone doesn't just jump to the perimenopause, but looks at what else could be going on. So I think, being aware of your body, of how it's changing, and fighting to be heard and evaluated in the healthcare system is really important. And then on the insulin resistance front, so November is actually National Diabetes Month, and a third of Americans have prediabetes, but 80% of us are unaware of the diagnosis. And again, women are susceptible to this if they have had insulin resistance during pregnancy, like gestational diabetes. And as we move into perimenopause, because the estrogen in particular helps us to regulate our insulin resistance. And so as we become more resistant to insulin, our blood sugar creeps up into the prediabetes range and then the diabetes range. And again, that happens also with age. So we have kind of confounding factors that are all leading us to become more insulin resistant, including genetics, lifestyle, excess weight that we might be carrying around, and then the diet has a big contribution to this as well. So for all these things, in addition to seeking support for hormone replacement, if that's something that you want to pursue, is the healthy lifestyle. And the American Heart Association has something called Life's Essential 8, which I think is helpful. But I wanted to just highlight three particular, and we've, I think, talked about all of these in different contexts so far today. But the first is really staying active and aiming for 7,000 steps or more a day, and incorporating resistance training in helps both with insulin resistance and then with bone health, that we'll talk about in a minute. And then on the diet front, also making sure that you're limiting added sugars and fried foods, and really prioritizing fiber and lean protein. Again, that helps with the insulin resistance and management of weight. And then sleep as well. And we talked a little bit about sleep earlier, but really prioritizing sleep over other activities if you find that you can't get enough sleep, because if your sleep is off, then you're not as likely to kind of pick healthy foods, to get the exercise you need. So managing sleep through stress management, avoidance of too much caffeine or alcohol, and then really, thinking about the boundaries. So if you need to put boundaries in place so that you can actually get to bed and get to sleep, I think that's a big priority. And you kind of have to think about what's my priority in this phase of life right now. My friend used to talk about the rice and salt years with the early childhood years, and you can't do it all, but sleep is one of those things that I would not sacrifice in this phase or any phase. So.